In males, sperm production begins at puberty and continues throughout life. But in females, we only produce eggs at the time the total supply of egg is determined before we are born, actually. And it's released when puberty begins, when the menstrual cycle begins. And female's ability to reproduce stops at the end of menopause. So when a menopause sets in, we can no longer reproduce. So the process of producing eggs in females is known as oogenesis. And oogonia are female stem cells that are capable of producing oocytes. And oogonia undergo mitotic division to produce primary oocytes that form primary follicles. Now, keep in mind, mitotic division leads to the production of identical daughter cells. So, as a result of mitosis, at first, the cells that form primary follicles initially contain 46 chromosomes, but they eventually undergo meiotic division to produce female gametes. So if you remember from the previous picture, primary oocytes are the first stage in formation of oocytes. And primary oocytes are inactive until puberty. But these primary oocytes are basically formed at the time of female gamete formation in the womb. So when the baby develops, they already start producing. When a female baby starts developing in the fetus, they already form primary oocytes, and they remain inactive until puberty. So at birth, we already have primary oocytes, and not until puberty do they get matured. So the hormone that causes primary oocytes to mature each month is known as follicle stimulating hormones. And each month we release these eggs. So basically, whether you want to reproduce or not, you produce eggs anyway. And if there is no fertilization, you shed the uterine lining and the process begins again. So by the time you're 35, all the healthy eggs are basically discharged already. But after menopause, we can no longer reproduce. Okay. So the cyclic monthly changes and all the processes that accompany these changes is known as the ovarian cycle. So the process of meiosis starts in a maturing follicle. The first meiotic division produces a larger secondary oocyte and a smaller first polar body. So the polar body basically cannot be used for fertilization. And the larger oocyte forms a secondary oocyte. And a vesicular follicle contains a secondary oocyte, which later gets released, and the remaining becomes the corpus luteum. So the maturation of a primary follicle takes about 14 days, and the whole process of the ovarian cycle takes place in about 28 days. So the ovulation of the secondary oocyte occurs by the releasing of luteinizing hormone. And the secondary oocyte is released, and it's surrounded by a corona radiata. And the sperm has to penetrate through the corona radiata. All right, so hope you get the differences right. The follicle stimulating hormone basically stimulates the maturation of the primary oocyte. And the luteinizing hormone helps in ovulation of the secondary oocyte. Okay. So this over here shows the oocyte being released from the secondary oocyte. So this is the mature oocyte that is released. It consists of an outer layer through which the sperm has to pass through. So meiosis is completed after ovulation only if the sperm penetrates the oocyte. So keep in mind, until then, meiosis is incomplete. So after ovulation, if the sperm fertilizes the egg, meiosis gets completed and the ovum or the zygote is produced, and 2 additional polar bodies are produced. And once the ovum is formed, the ovum ends up having 23 chromosomes, and the 23 chromosomes of the ovum combine with 23 chromosomes of the sperm to form a zygote, which ends up having 46 chromosomes. Now, if the secondary oocyte does not get penetrated by the sperm, the secondary oocyte dies and it does not complete meiosis to form an ovum. All right. So meiosis in males produces 4 functional sperm, but in female it produces 1 functional ovum and 3 tiny polar bodies, which are basically just waste products and cannot be used for fertilization. So out of the 4 gametes that are produced, only 1 is functional, is how you can think of it. Now, the difference between sperm and egg is that sperm is tiny, motile, and it contains seminal fluid. They have a different structure. The egg is large and non-motile, and it has nutrient reserve to nourish the embryo during the process of implantation. So there are several hormones that are produced during the process of the ovarian cycle. One of the main hormones is estrogen. So the estrogen in females is responsible for secondary female characteristics. It's also responsible for development of breasts, appearance of axillary and pubic hair, increase in fat beneath the skin, especially the hips and the breast, and it helps in widening and lightening of the pelvis, and it helps in onset of the menstrual cycle. The other hormone that it helps in regulation of the reproductive cycle is progesterone. Now, progesterone is produced by the corpus luteum, which is a structure that remains after the egg gets released. Sorry, not the egg. The oocytes get released of the secondary oocyte, and the production of progesterone continues until the luteinizing hormone gets reduced. So, until there's luteinizing hormone in the blood, the production of progesterone continues. So the progesterone itself does not contribute to the appearance of secondary characteristic, but it helps in maintaining a pregnancy and prepares the breasts for milk production after pregnancy. Both estrogen and progesterone from the ovaries basically drive the uterine cycle and help in monthly changes of the uterus. So the menstrual cycle takes place in about 28 days, and it is regulated by the cyclic production of estrogen and progesterone by the ovaries. And the other hormones like FSH, which is the follicle stimulating hormone, and luteinizing hormone, they target the ovaries and drive the ovarian cycle. Both these hormones are produced from the anterior pituitary gland. And the other hormone that's not mentioned over here is gonadotropin releasing hormone, which is secreted by the hypothalamus. And the gonadotropin releasing hormone basically controls the female reproductive cycle because the GRH stimulates the anterior pituitary gland to secrete follicle stimulating hormone. So ovulation alone typically occurs through a cycle of midway through the cycle on day 14. So there's an ovulation period during which fertilization is most efficient. So this menstrual cycle can be divided into the menstrual stage, proliferative stage, and the secretory stage. During days 1 to 5, it is called the menstrual stage. During the menstrual stage, the endometrium layer is fluffed and bleeding occurs from 3 to 5 days, and the ovarian hormones are at the lowest level during the menstrual period. And by day 5, the ovarian follicles produce more estrogen. Now from day 16 to 14, it's the proliferative stage. And during the proliferative stage, the estrogen levels rise and the endometrium is repaired again. It thickens and becomes well vascularized. So the estrogen basically helps perform all this. And at the end of the proliferative stage, when the uterus is ready, ovulation occurs at the very end of the stage. So the third stage is the secretory phase. Now during the secretory phase, the progesterone rises and it increases blood supply to the endometrium. And the endometrium basically increases in size and it gets ready for implantation. Now, during the secretory phase, if the fertilization occurs, the embryo produces hormone that causes the corpus luteum to continue producing its hormones. Now, if there's no fertilization, the corpus luteum degenerates and the luteinizing hormone in the blood levels decline. And this process is repeated every 28 days. So the ovarian cycle can be divided into the follicular phase, where the primary follicle matures into the secondary follicle. The next stage is called the ovulation. And the ovulation basically is the process of releasing the oocyte from the secondary follicle. And the last stage is the luteus stage, which has everything to do with the corpus luteum. If you remember, the corpus luteum helps in secreting a lot of enzymes during the process of the ovarian cycle. Now, if you look at the levels of hormones during different stages of the menstrual cycle, the FSH levels are initially high during the follicular stage. So this over here in blue is the dark blue is the follicular stage, and during the follicular stage, the follicle stimulating hormone levels are really high. So this helps in signaling the oocytes to mature. Now, during the ovulation stage, there's a huge spike in the luteinizing hormone levels. not so much the FSH. Really, this LH should be slightly towards the side. So the luteinizing hormone levels triggers ovulation, which is the release of the oocyte from the secondary oocyte. And this stage in green is the luteal phase. Now, the luteal phase signifies rising levels of other hormones, which is mainly estrogen and progesterone. So when the estrogen and progesterone level rises, they inhibit the follicle stimulating hormone and the luteinizing hormones. So their levels decrease. And why do they get inhibited? Because the estrogen and progesterone basically tell the ovary to wait for fertilization. If fertilization does not occur, the corpus luteum gets degenerated. And when that happens, when the corpus luteum degrades, it basically degrades when there's no fertilization. And when there's no fertilization, the levels of estrogen and progesterone fall again. But this graph only shows the luteinizing hormone and the follicle stimulating hormone. Okay. So if you remember, right about here, the levels of luteinizing hormone and the follicle stimulating hormone were really, really high in between days 10 and 15. But when there's a spike in LH and the oocyte is released, it leads to the next hormones that get spiked are estrogen. So the estrogen is an important hormone that works with progesterone in thickening the uterine lining, and it also helps in development of ducts in the mammary glands. So it basically prepares a person for pregnancy, but it's also one of the main hormones that is responsible for regulating the ovarian cycle. So when the levels of estrogen and progesterone rises from day 10, this is day 10 to 15, you see a spike in estrogen level, and in between day 15 and day 25 you see a spike in progesterone. And when the estrogen and progesterone level rises, it inhibits the follicle stimulating hormones and the luteinizing hormone. Now, after this, if there's no fertilization, the estrogen and progesterone levels drop. And again, the follicle stimulating levels rise and the luteinizing hormones level rise. The other accessory reproductive organ is present in both males and females, the mammary glands, but they only have a function in females. So mammary glands are basically modified sweat glands, and their function is to produce milk to nourish the newborn. And this is stimulated mostly by estrogen. So the estrogen basically helps in development of the duct system in the breast, and progesterone help in developing the milk secreting glands, which is called the alveoli of the breast. And the different parts of the mammary gland include the areola, which is the dark pigmented region, and the nipple, which is the protruding central area of the areola, the lobes, which are the inner structures that radiate around the nipple, and the lobules within each lobe, which contains a lot of glands that produce milk when a woman is lactating. So these glands are known as alveolar gland, and the lactiferous ducts connect the glands to the nipple, and the lactiferous sinus is the dilated portion where milk accumulates. So this is a picture of the mammary gland. So this is the nipple. So this dark region is the areola, and this is the lobe, and it's surrounded, the mammary gland itself contains a lot of adipose tissue. And these are the lactiferous sinuses and the ducts where milk is stored, and the lobule that contains the alveolar glands for producing milk. Okay. So mammography is the X-ray examination that detects breast cancer, and another way you can detect breast cancer is by palpation, by feeling lumps around the breast. American Cancer Society recommends that mammography must be conducted for women between 45 and 54 years every two years to check for the presence of any cancerous tissues in the breast. So the most common change during breast cancer is change in skin texture, puckering, or leakage from the nipple are the main symptoms for the formation of breast cancer. So this picture over here shows a mammogram which shows a normal breast and the formation of tumors within the breasts. Breast cancer is the second most leading cause of cancer death in the US. 1 in 8 women are affected, rarely before 30, but it's more common after menopause. And the risk factors include family history. When people do not have children, it increases their chances of having breast cancer. Exposure to radiation, alcohol, and smoking all add to the risk factors of breast cancer. Treatment include lumpectomy. They remove the lumps from the breast, or they perform a radical mastectomy. They remove the breast completely. Or radiation therapy and chemotherapy. Now, after the sperm and egg get fertilized, they lead to the formation of an embryo. And the embryo, once it gets implanted into the uterus, leads to pregnancy. Now, pregnancy is the time from fertilization until the infant is born. And conception is basically, or conceptus is developing offspring. The embryo is a period time between fertilization until 8 weeks, and after 8 weeks, it's called the fetus. Now, the gestation period ranges for about 280 days until birth. This varies from person to person, and of course medical reasons may change the gestation period. So from fertilization to week 8, you call it an embryo, and after 8 weeks is called fetus. An oocyte is viable up to 24 hours of ovulation, and the sperm is viable for up to 48 hours after ejaculation. For fertilization to occur, the sexual intercourse must occur no more than 2 days before ovulation and no later than 24 after. So there's a window of basically 4 or 5 days where ovulation occurs, and that's when fertilization has most probable chances of occurring. Now, sperm cells must make their way to the uterine tube for fertilization to be possible. But after fertilization occurs, it's transferred to the uterus and implanted in the uterus. When the sperm reaches the oocyte, the acrosome that contains lysosome, it digests the egg, and it allows the sperm to penetrate through the oocytes. And the oocyte then undergoes secondary meiotic division to produce an ovum and a polar body. The polar body is basically useless, and the ovum is the only one that can be capable of actually forming a zygote. So this shows how many, so many number of sperm try to enter the egg, but only one or two are capable of actually penetrating through the egg to form a mature zygote. Okay, so after fertilization, the amniotic sac is formed and yolk sac is formed. The umbilical cord is formed through which the zygote receives oxygen supply from the mother, and then the placenta is formed. And the amniotic fluid or the chorionic villi can actually be sampled to identify genetic abnormalities in a developing fetus. And although they give a lot of information on genetic abnormalities, these procedures are considered really risky and may lead to miscarriage as well. So these are high-risk procedures. Now, some other things that we haven't talked about are menstrual abnormalities, like amenorrhea, which is absence of menstruation, dysmenorrhea, which is pain associated, dysmenorrhea is with pain associated with menstruation, and abnormal uterine bleeding. Sometimes that happens with excessive amount of menstrual bleeding. These are some common conditions that are seen in regard with the menstrual abnormalities. And hysterectomy is the process of removal of the uterus. Now, like I said, this is one organ which does not affect life. You'll still survive. One of the organs. Now, sometimes hysterectomy is considered a solution for conditions like ovarian cyst, endometriosis or excessive bleeding, cervical cancer or uterine cancer, ovarian cancer. Hysterectomy is performed in all those cases. And during a complete hysterectomy, the uterus and the cervix is removed. During a radical hysterectomy, it only the uterus or only a specific portion like a uterus, cervix, tube, or ovaries or a part of the vagina are removed. Now, in males, we did not talk about erectile dysfunction, which is basically impotence. And this is the inability of the males to hold an erection long enough for sexual intercourse. It can have several different causes, like psychological or emotional factors or physical factors. And over the count, there is medication called Viagra that causes vasodilation. Vasodilation basically helps in engorgement of blood to the penile arteries to cause an erection. So these are something we did not talk about, but just be aware of these conditions. Oh, also in females, I'm sure a lot of you have seen ads on endometriosis. Endometriosis is the growth of the endometrial tissue outside the uterus. So let's look at the picture of the, okay, where is it? I'm looking for a picture of, oh, there it is, of the uterus. So the excessive growth of the endometrial tissue outside the uterus causes endometriosis. And this is a tissue that is discharged from the open end of the uterine tube during menstruation and can cover ovaries and the outer surface of the uterus. And the problem is that the tissue responds to hormonal changes by proliferating and breaking down, which causes excessive pain and scarring, and sometimes causes infertility as well. So just be aware of these conditions that you come across on an everyday basis, and you see ads about them. And now the reproductive system is associated with sexually transmitted disease, and sexually transmitted diseases are on the rise in the United States, and the most common sexually transmitted diseases are chlamydia, gonorrhea, and syphilis. Make a note of this. Chlamydia, gonorrhea, and syphilis are the most common sexually transmitted diseases in the United States. Now, the other diseases include genital herpes and AIDS and hepatitis B. And in females, you often come across yeast infections, which is caused by a fungus. And the yeast infections can be caused maybe by antibiotic therapy, or they're also related to stress. When the pH in the vulvovaginal opening gets disrupted, it can lead to an imbalance in the microbiota along the vulvovaginal opening. And when you have a yeast infection, now this yeast infection is caused by Candida albicans. Let me write it down over here. Candida albicans. Oops. Okay. Candida albicans. Candida albicans. So Candida albicans is the yeast that causes yeast infection in the vulvovaginal opening. And the symptoms include inflammation of the vagina, severe itching and pain, and yellow discharge with odor. And this is very common in females because they have a smaller orifice, but it's not so common in males. So please be aware of these major conditions in the females because you might see maybe Candida albicans in the final exam. So please make sure you know this. With this, we have completed the reproductive system. Just focus on the topics we have covered in the lecture. So your final exam will consist of chapters 15 and 16.